It takes is a shot in the arm to protect you and others from COVID-19, but for some, it may come with a few side effects.
Some people may have a sensitivity or an actual reaction to a compound within that vaccine.
Michael Urban is a doctor of occupational therapy and a professor at the University of New Haven.
For Johnson & Johnson, you're one and done, if you want to think about it. So again, you go through this once. Pfizer and Moderna, you may experience this very mildly. They're saying what we're seeing on the first shot. And then we come around to the second shot. That's where you're seeing a little bit more intensity for some people.
Why is that, though?
It comes down to the body's mounting that more of that response, that immune response within your body. So you're going to have some antibodies there. So it's going to go in and sort of stimulate a second and larger immune response potentially within your body to help build those antibodies.
He says it's also important to know the difference between a side effect and an allergic reaction.
You'll know if you're having an adverse reaction, such as if you're allergic to shellfish and you take this vaccine, it's going to be almost within minutes.
According to the CDC, common side effects include pain and swelling at the injection site, fever, fatigue, headache, and mild cold or flu-like symptoms.
There are always outliers. Everyone has something a little bit different, at maybe less than 1%, and it's very quick and temporary and it goes away.
What if you're one of those people that have this really odd side effect after getting the vaccine? What should you do?
So typically what I would recommend is, depending on the severity and how much it's impacting your everyday functioning, but something, not affecting your breathing. If it is something like for example, like the ringing, maybe get a ringing in your ears. If it's something that's sitting there, if it's not getting worse, it seems to sort of plateau. Typically, you may call your doctor right away.
Are there long-term side effects that'll just linger, kind of like the long haulers after getting COVID?
I have not heard of that yet. That's always being watched.
In the meantime, Dr. Urban says the best way to overcome those annoying side effects is to get plenty of rest, stay hydrated, and plan ahead. And while you may be sidelined from your normal routine for a short time, getting the vaccine will have a lasting impact. Stacey Ann Gooden, Pix 11 News.